Hi, my name's Nicola. I'm a children's advanced nurse practitioner working in West Middlesex A&E department.
And my name is Dominic Mathur. I'm one of the pediatric A&E consultants.
We're doing this video today to try and help the flow of patients coming through the A&E department. We know when your children are unwell, it's a very scary and worrying time because symptoms such as temperatures can cause lots of other symptoms that are concerning to you and your family when you see them in that condition.
We are under huge amounts of pressure at the moment, as you know, and this is called an accident and emergency department for a reason. It is for accidents or emergencies.
We're seeing quite frequently people bringing their children in that have had temperatures for less than 3 days, normally sometimes just in the last 24 hours, without trying any home remedies before bringing them into the department.
Fever is actually a good sign. That means that the body is trying to fight an infection. And if the fever is lasting for less than 3 to 5 days, you can do certain things at home and do not need to straight away bring the child to the accident and emergency department.
Things you can try at home if it's causing them any discomfort, pain, clingy, crying, is maybe first trying to give them some paracetamol and see if this helps reduce the symptoms that they're displaying at that time.
Fever is defined as a temperature of 36.6 degrees Celsius and above, and it is usually worrying only if it's going above 38.5 degrees.
You can manage a child's temperature, as we say, by first of all trying some paracetamol. If this doesn't work, you can half an hour later maybe give them some ibuprofen to see if this reduces the symptoms. We're not trying to always reduce the temperature, but when obviously a child has a temperature, they get miserable, they sometimes feel a bit irritable, they sometimes stop eating, they don't want to drink as much, they don't want to play, and normally this can relieve those symptoms and give them back to their usual behaviour.
The first thing to do is take off their clothes, because very often we see that the children come here in high fever with lots of layers of clothes on. So take off the clothes, put them in a well ventilated room, open the windows, keep the room cool, and these measures usually help to bring down the temperature.
You could then encourage them to drink some fluids because that is the most important thing to keep them hydrated. Some people worry about them not eating. We're not so concerned if they're not eating as long as they're drinking well.
We don't feel like eating when we are unwell. As long as they are drinking and passing urine, that's okay. They may be passing less urine because body tries to hold on to the fluid. So they wee less and the nappies may be less than frequent, but as long as there are some nappies, that's a good sign.
You can use rehydration solutions such as the sachets you can buy over the counter. However, children don't find these very tolerable. So the best thing to do is maybe use something like half apple juice with half water. Ice lollies, yogurts, custards, jellies, they all count towards fluid while giving their body some sugars and salts it needs to start absorbing the fluid and keeping them hydrated.
There is a misconception that giving cold things like lollies to children will cause them infection. That's not the case. Infection is most of the time caused by viruses and it will get better in 3 to 5 days. So you have to give it some time to get better. And also, for the fever, you have to measure it with a proper thermometer that goes in the ear, not the one on the forehead because they are extremely unreliable.
For babies under 6 months or even under a year, it's sometimes best using the digital thermometers that you can put under the baby's arm to help measure the temperature. Because again, the scan-in forehead thermometers that are out in the market now aren't as accurate as a tympanic in the ear thermometer or an under the arm thermometer.
But if your baby is less than 6 months and has fever, you should get them checked by a medical practitioner. That can be your GP. You don't need to bring them straight away to accident and emergency department.
Going back to having cold things, if your child has a fever, the ice will help reduce inflammation in the throat, which may be making children not want to eat and drink. It will help reduce the temperature because it's cold, and it will help offer fluids and nutrients that your child may not be taking in at that stage because they don't feel like eating.
So as we said, you can wait for 3 to 5 days before the fever starts settling down. But if it's in more than 5 days, you should seek medical advice and bring the child either to the GP or to any department if the fever is going very high and not going down even with paracetamol and ibuprofen.
If your child, there are some red flag symptoms to look out for. If your child has a rash that does not fade away when you push a glass against it or stretch the skin with your fingers and the red spots still stay there, this is a red flag to bring them into the hospital.
Also, if they are looking pale or mottled and they are abnormally cold to touch, or if they've got blue lips, or they are having severe breathing difficulties and working hard, like sucking in the chest a lot, you should either dial 999 or bring them to A&E urgently.
If they are not keeping any fluids down or taking 50% less fluids than they usually would over a 24-hour period, if they're not having wet nappies or less than 50% their usual amount, or going to the toilet for a week, less than 50% their usual amount, is another reason to bring them to A&E to get them seen.
Also, if they have a fit or a seizure, or they become extremely agitated, you can bring them to A&E department.
If you're giving them medicines like paracetamol and ibuprofen, or you are cooling them down, they are drinking, but they are quiet, not themselves, or very irritable, please do not hesitate and get them seen as soon as possible.
But most of the children that present to the A&E department have had a fever for 1 or 2 days with cough and cold, which is very common in the winter season. And with COVID, we have seen that they have become more common in the summer as well. So just don't come to A&E if the child has had fever for just 1 to 3 days and has been drinking and is active in between. You can just either go to a pharmacist, seek some advice, or go to your GP.
Another thing to remember at the minute, COVID hasn't disappeared. It is still around, and we're seeing an increase in the number of patients coming through with COVID at the minute. So if you're unsure, please do a COVID test to see if it is COVID causing your child to be unwell. If you've got any advice you want to look at the red flag traffic system, please use the World Health Organization 0 to 18 year website that you can find online, and it goes through each symptom your child may have, whether that's an earache, sore throat, temperature, cough, cold, anything like that. Then please go to the website. Thank you.